But first, there is nothing more precious to us than family. It is a simple yet profound statement that drives the people behind our first featured organization. The Ohio Council for Home Care and Hospice is dedicated to helping families who need services to improve the quality of life of a loved one, or in some cases, help in the final stages of that loved one's life. Joining me today is Kathleen Anderson of the Ohio Council for Home Care and Hospice, and also Terry Medley, who has relied on your services. Welcome, ladies, to both of you. Kathleen, let's start with you with a simple explanation of what your organization is all about and what your goal is.
Well, thank you, Dave. I appreciate you inviting us to be here today, and especially that NBC4 has decided to make this Awareness Month. It really does mean a lot to the industry and to those Ohioans who need care at home in their remaining days. Ohio Council for Home Care and Hospice is a nonprofit association whose mission and vision is to provide advocacy, information, and education to agencies in Ohio. We're one of the nation's oldest and largest serving agencies. We've been around since 1965, and we have over 520 home care and hospice agencies are members of our organization.
And you are multidimensional. You help families select what services they need, correct?
Right. At our website, we have a patients and families web portal, and we have information there. Also, we provide the names of hospice agencies that they can choose from. Also, what are the questions that you need to ask on behalf of either your family member or yourself that you need to know to make a good decision?
Let's clarify, just so people understand, your organization's relationship with hospice itself.
Hospices actually choose to join us as an association.
I see.
And as that association, we provide for them information, education, so they can better serve Ohioans, and advocacy. And I did want to make a point about advocacy. With awareness, we talk about it's a two-prong approach for us. Advocacy for people just to understand what is hospice, but to better educate our policymakers about what is hospice. Right now, with the recent elections and a big change with Congress, the Ohio House of Representatives, and the Ohio Senate, we have 36 persons who have never held public office before, who we need to reach out to and educate them about what is hospice and how people in their communities can be better served, and that when they're looking at legislation or changing regulations, what they need to be aware of so that they don't over-regulate. So, and we have a new governor coming in, and so we've also got to educate the governor and the new cabinet members.
Right.
So we've got quite a bit in store for us.
Lots of work to be done, no doubt. Terry, let's turn to you, because 9 years ago you turned to Kathleen's organization for some help with your husband, and I'm just curious how they helped you through that time.
You know, we were very fortunate in that we had a physician who believed in the benefits and the value of hospice care early in a diagnosis and a prognosis. And once we received the prognosis that Michael only had 6 months to live, he suggested hospice. And with the help of the Ohio Council for Home Care and Hospice, we were able to select a hospice that would meet all of our needs. And the quality of life in dying was directly related to the care that the hospice individuals gave to us. You know, the hospice premise is the quality of life through death, and in that process they were so compassionate, so caring, so loving. Michael was pain-free, he was anxiety-free, as were we, you know, and they gave us information to make good quality decisions about quality of life at the end stage. And, you know, if death could be a good death, Michael had a peaceful, serene, quiet, pain-free life and death. And so for that, we're very, very grateful. It was a blessing to have hospice care for the length of time that Michael was left with us.
And just a little bit of time here, but if you could explain the benefit to your family as well, because it sounds like it helped everyone.
It did help everyone. You know, it is it is such a difficult time to go through as a family because you know you're going to be losing someone. And so hospice staff were able to provide us with that emotional support during and even afterwards, so that there was a period of time that they were checking on myself and my son to make sure we were doing okay. So they provided not only the physical care for Michael, they anticipated his needs, but they also anticipated our needs as family. And so, you know, that transition of living to death, it's very, very difficult, but it's nice to have an organization such as Hospice who walks with you through that. Yeah. And it was really quite comforting.
Terry, thank you for sharing your story.
Thank you.
Kathleen, thanks for being here with us as well.